This presentation is brought to you by the Belzhansky Foundation. Over 50 years of research towards curing cancer the natural way.
Okay, hello everybody. My name is Larisa Likver. I am a medical doctor, board certified in physical medicine and rehabilitation, and I specialize in non-surgical regenerative treatment of our musculoskeletal problems. So why are we here? I think we're here because our entire life we dreamed to learn. Why do we have pain and inflammation to begin with? What the foundation for the healthy musculoskeletal system? What does conventional medicine can offer us? And how can alternative medicine can help solve the problems conventional medicine cannot? So why do we have pain and inflammation? Well, why do zebras have stripes? Not for camouflage. Why do fish have fins? To swim. Why are babies so cute? That we will care about them. So everything in nature serves a purpose. So what do we have? Once again, why do we have pain at all? Pain, it's actually the way of our body can communicate with our conscious. And when I'm saying pain, I'm talking about the musculoskeletal problem, our back, knee, shoulder, you name it. So when we have pain, this is the way our body communicates with our conscious and letting our brain know that something was damaged or injured and asking, it needs to be repaired, and body needs some time to deal with it. So pain serves quite a few purposes. First of all, to provide some rest to injured, damaged areas and give the body the chance to take care of it. It means to heal itself. It limits our ability to move around and thus to prevent further injuring and further damaging. It also teaches us what not to do to prevent damaging happening again in the future. So there are quite a few classifications of pain. One of them, pain classified based on time frame. We have acute pain, which lasts from the moment of the injury or incident up to 3 months. And this is very critical time when our body very actively working on repairing the reason of the pain. We have subacute pain from 3 to 6 months when body kind of like wrapping up the work. And we have chronic pain which lasts more than 6 months. Every pain which lasts more than 6 months, every chronic pain is a pathological pain. If our body has everything what is necessary, and body absolutely will deal and get rid of the source of the pain. So if we have pain more than 6 months, something wrong, something didn't go right, and body were not able to repair the damage. So why we have inflammation? Let's take a look at the one of definition of inflammation. Inflammation is part of the complex biological response of our body tissue to harmful stimuli. And it's a protective reaction involving immune system, blood vessels, and molecular mediators. Inflammation is the first stage of healing. Without inflammation, we will not have the healing process going on. And you know, it's sometimes very confusing. A lot of time, sometimes inflammation might be bad when immune system over-irritated, it goes above the normal range. But when we're talking about the regular standard mechanical injury to our body, inflammation is absolutely crucial, necessary for the healing process. But at the same time, everything in moderation, including the moderation. So when we have pain, which is kind of mild, we can take it rather easily, we can go on with our life. But when pain is moderate to severe, we do need help. We have to get it under control. So what options do we have? We have two major different approaches. We have conventional approach and we have alternative approach. So what conventional treatment options for pain condition? We have a bunch of different types of pain medication. We have non-steroidal anti-inflammatory medications like Advil, Aleve, naproxen, everybody knows that. We have non-opioid pain medication like Tylenol. We have opioid pain medication. It's a crisis now in our country with Vicodin, Tylenol 3, and a lot of other things. We have corticosteroid injections, which is an extremely powerful anti-inflammatory drug. And for dessert, we have a surgery. So as a society, we kind of get used to quick fix to any problem in our life, including problem with our health. So when patients come into the doctor office, most of the time, doc, fix me quickly. And with the modern managed care era, doctors actually kind of squeezed in between walls and in ceilings and floors they're trying their best to diagnose patients quickly and provide some kind of relief, some kind of answer. Well, the quick fix, it's not always the right answer. So what about alternative options? If experiencing pain, it is extremely crucial to understand the root cause of the pain and treat the roots, not the cutting off leaves. Alternative treatment options, we have a lot of varieties of it. Let me mention just the probably most common, the most known. Prolotherapy, PRP or platelet-rich plasma therapy, ozone therapy, lift of perineural injection technique or PIT, stem cells. So why regenerate? Why to help our body to heal itself to start with? Well, because surgery is not always the right answer. So I don't think that everybody dreaming to have their spine like that with a lot of screws and rods and into their spine. Probably some people will prefer to have couple, needle pinches and help the body to heal itself and have your own original body in a great condition. So what is the answer to restoring healthy musculoskeletal system? The answer, I forgot my model. The answer is tensegrity. Tensegrity, it's actually engineering term. And in regards of the human body, it's a dynamic equilibrium between firm, not flexible, and flexible structures in our body. So non-flexible, it's our bones, and flexible, it's tendons and ligaments. And when those structures are in balance, our musculoskeletal system can withhold and stretching and pressure. It can rebound right back in a normal functional condition. But if we will overstretched or rupture just one tendon, you can imagine this human representing us. If you will cut off at least one stream over there, the entire structure will collapse completely. And it will influence our entire musculoskeletal system. Some part of the tendons and ligaments will be overstretched, another part will be compressed and tightened up. And our muscles has to compensate to still let us move around. And entire structure will go off. And any idea if any medication, any pill, any cortisone shot can fix that? No. If we want to have our good functioning, solid, healthy, pain-free musculoskeletal system, we have to do everything what we can to restore the tensegrity, to restore dynamic balance between our non-movable part, our firm part, our bones, and our stretchable part, tendons and ligaments. Let's take a closer look at alternative treatments. Prolotherapy. Another name for prolotherapy is non-surgical reconstruction of tendons and ligaments. So prolotherapy involves multiple injections of irritant solution into joints, in the joints, tendons, and ligaments attachment to the bone. With this treatment, we are creating good controlled inflammation, which is the first stage of healing. Inflammation will activate immune system, will activate endocrine system, will activate all necessary participants to help our body rebuild the injured part. And body will do the job. Our goal only to trigger the regenerative process and provide our body with all necessary support, nutrients, supplements, proper exercise, and so forth. And body will do the job. Another method is PRP or platelet-rich plasma therapy. The same basic idea, but it's more advanced technique. We take patient blood, spin it in a special centrifuge, separate it, concentrate it, and inject back to the area which is compromised. And those concentrate of our plasma, of our blood, has a lot of platelets. Platelets, it's a small blood particles which have a lot of so-called growth factors, and the name speaks for itself. Growth factor trigger growth, regeneration, rebuilding. And our body again and again will do the job. Ozone therapy. So ozone, it's an active form of oxygen. Regular oxygen molecule is O2, ozone is O3. So we have extra atom, which is loosely attached, and when we get into the body, it will be engaged very quickly in biochemical reaction and will provide oxygenation to the tissue. So the same like person is sick, what we do, we give proper medication, hopefully, good food and fresh air. The same happens with the body. With oxygen, tissue regenerate better. Lift of PIT, peridural injection technique. Its target of this technique, it's tiny nerves located underneath of the skin, which are responsible for painful stimuli, burning cessation, cramps, and most importantly, responsible for the regeneration of the tissue, which is located directly underneath of these nerves. With this type of injection, which is very superficial, the inflammation from these nerves subsides and regeneration goes much quicker and better. So it sounds like a lot of fancy name and fancy approaches, but basic idea, it's not new. And we all know the new, it's a forgotten old. And technically speaking, Moses was the first person with a tablet downloading data from the cloud. So it's new, but not so new. In Roman times, hot needles were driven into the shoulders of injured gladiators in order to trigger inflammation, thus facilitating the safe self-healing process. Once again, we trigger inflammation to help our body to heal itself, and Romans knew that. Well, there is no significant changes in human body from Romans' time to New York time. So, regenerative solution for musculoskeletal problems. Prolotherapy and PRP therapy are regenerative methods to trigger good, controlled inflammation, thereby facilitating non-surgical reconstruction of tendons and ligaments, which are foundation of the tensegrity and thus foundation of the healthy musculoskeletal system. Let's review a few cases. Case number 1, small business owner struggling with chronic shoulder pain. His hobby is playing tennis. Complains chronic pain on the right shoulder for over 3 years. Pain level 7 out of 10 on a scale from 0 to 10. When 0, no pain at all. 10, the worst pain in the world. Functional limitation, could not sleep on the right side and could not play tennis. Treatment tried Tylenol, Advil, home exercise program. Before seeing me, was seen by orthopedic surgeon and was diagnosed with rotator cuff syndrome due to partial rotator cuff tear. Only option, well, he was offered to have a cortisone shot, and if it will not work, to have a surgery. Eugene saw me for a second opinion in April 2019. Treatment provided monthly PRP with ozone to rebuild rotator cuff tendon and other supportive structures of the shoulder joint. 3 treatment total, 1 treatment per month. PIT for the right arm to control neurogenic inflammation, physical therapy referral, home exercise program, diet modification, food supplements. Upshot. 4 months later, Eugene was 100% pain-free without any functional limitations. Now he can sleep on his right side and he can play tennis. Case number 2. Artist struggling with chronic low back pain. Maria, 69 years old. Her hobby is yoga. Complains low back pain for over 5 years. Pain was provoked by standing, walking, and some yoga postures. Pain level 8 out of 10. Functional limitation: inability to walk more than 4 blocks, inability to participate in yoga practice in a full capacity. Treatment tried: pain medication, physical therapy, home exercise program. Before seeing me, spine MRI revealed back arthritis and mild arthritis, and in the right hip arthritis also revealed mild arthritis in her right hip. The only option what she was offered, back surgery. Maria saw me for a second opinion. Treatment provided: monthly back prolotherapy with ozone, monthly right hip prolotherapy with ozone, PIT with each prolotherapy treatment to control neurogenic inflammation, physical therapy referral, home exercise program, diet modification, food supplement. After 5 months of treatment, Maria was 80% improvement in her condition, was able to walk 10 blocks, and was able to sit in her favorite lotus posture. Case number 3, a young gentleman, 35 years old, with the intractable abdominal wall pain, which was provoked by breathing in any torso changes, any position in his torso. He was evaluated by gastroenterologist. A blood test was with a normal limit. Abdominal and chest CAT scan was with a normal limit. So he was without diagnosis. No treatment was offered, and he was recommended to be seen by a psychiatrist. So he saw me. He was diagnosed with a mild disc herniation in the upper back, which caused nerve root irritation, which in turn caused nerve irritation, which is responsible for sensory in the abdominal wall. And PIT, perineural injection technique, 2 sessions, 1 week apart, gave him 100% resolution of his condition. Now he can surf again, and he can lift his weight, but with some modification. So what we have learned today: now we know why we have pain and inflammation, because our body needs this, because if we have it, it means our nature designed to have this condition to help us to heal ourselves. What the foundation for the healthy musculoskeletal system, it's a tense integrity, we have to respect that, and how alternative methods can help, which conventional methods cannot. So don't let your learning to lead to knowledge. Let your learning to lead to action. I have to stop now, and never doubt your body. Stay healthy.